Okay, so I would say this topic or the talk is not to define anything, as in this is the only way to bring in social determinants or nothing at all. I just thought that everyone here is talking a lot of different aspects of healthcare in general, but I didn't find like a lot of topics related to behavioral health or social health in general, which is really, really important. So I thought like I can just open up some sort of a primer or an introduction on this, and then maybe I would also love to hear if you guys have ever worked on anything related to that. That would be great. Okay. This isn't moving. Same thing. Okay, so talking about social determinants, it's so huge as such, and I was thinking like how do we really start about it, like to generally bring that topic in. I just can't bluntly say okay, let's just talk about it and the economic benefits of it, but generally in when we talk about healthcare spending, we'll always see US on top of it, even though when like other countries who are in the same income wise or like GDP wise as US, we would see that US is one of the top in healthcare spending. But when we trace back to the reasons or like what are the fundamentals relating to the spending, we always kind of talk about medical care, but it's not really the only one. Medical care is a part of the healthcare spending, but it's not the only one. So there are some other things as well which definitely relate to our quality of life, end of the day. So social determinants is one of them, and there've been a lot of research on like debating on which is the top one and what contributes the most. But there was one interesting article from National Academy of Medicine, and they kind of found that medical care was only about like 10% contributor towards the healthcare overall like expenditure or towards health outcomes, while about I think 70 to 80% was about social determinants of health in general. Again, that's too broad. So talking about SDOH, I've just been blabbering SDOH ever since I came in here. But what is that all about? So it's nothing but it's more about the environment that we live in, that we were brought up, that we are at, and it's basically our day-to-day life that we are at. So there are a lot of broad domains as such about social determinants, and some of them are your education in the neighborhood that you live in, your education level, your access to education, and also with the levels of education, like primary and like different kinds of college up to what in your area, and your healthcare access, your neighborhood status in terms of income and like other things, and economic stability, and also your community's participation in a lot of things. So these are like some of the broad categories. There might be more, but I would say these would be good enough to start as like a broad category when we talk about social determinants in general. And now that we are just talking about data and we know that there's like a lot of data available, so what can we really do when we talk about these broad categories, or what can we do with the available data that we have? So I don't know, like how many of you have ever worked on anything related to SDOH, or like do you think you ever have any experience on finding the data related to that? Sorry to question you guys back, but I'm just curious. How many of you have done that? Oh, I'm so happy. Okay, that's really nice. So I'm sure you've been aware about the open source data available. So I work with Commonwealth Care Alliance, which is a nonprofit healthcare company, and we kind of are always on a hunt of finding the right data for SDOH and a lot more other things as well, but this has been like one major topic there. So I found that there was some interesting open source data which I didn't know before, and they were these. Obviously ACS, anyone would know, it's the survey data, but I just wanted to put it out there. And historical air quality was very interesting because it kind of gives you like the air quality by area, by like every province or like county, whatever you choose to, and you can find how does that look like and how that's been changed over the past years, and you can relate that to your healthcare as well. So that's available open source. Again, ADI is also available open source. Area is a deprivation in a particular area, and that's actually calculated from your ACS. Community survey is very large, like it has too many indicators I think it's above 400 or something, the number of indicators. So what ADI does is they kind of take the top attributes from that and they create like a single index for you from the ACS. So it's like sort of the summarized score, which you don't need to do, but it's already like readily available for you. So the last one is vulnerability index. This one you'll find in the geospatial area. You would have it as like Excel files in the government website if you go and like check it out. But if there's someone who is interested in like analyzing the data in general, I think you should definitely check these out, because when we talk about like a particular member's data and like population health, going from a particular member's data, you can actually combine that to a neighborhood level. And for a neighborhood level, you can use any kind of pin code or like whatever access that you want to take with level, and then grab these data, and then you move on to like population health end of the day, because that's what it is, a group of population together. So I feel like with the advancements in data and with the like so many companies actually providing us for free, so we should try doing something with it. We tried a couple of projects. I tried working on creating like a social risk score for every like patient. We have other EHR, EMR data through which we can actually show the reflection of your medical risk or hospitalization risk and other things. But there was this piece missing about social risk and even about mental health. So we tried using some of these data and also some others to create like a social risk score, which would say that at any point of time, what's the risk of this member in terms of their SDOH. So it really has helped. So just small light on that. And some of the interesting data points that I thought from all of these that I showed earlier were like air quality, neighborhood stress was very interesting. I think also CMS provides it. I think it's called NSS 7. So they provide it on a yearly basis, I guess, and they usually talk about the stress a neighborhood has from your violence, crime status, and like a lot of other things. But it's also available in the data here, so we can actually create that by ourselves by adding other things which maybe CMS has missed at. Like for example, RAF score, our risk adjustment factor, that more sort of leans towards financial cost and like recapture of HCC codes, but the part that's missing is SDOH again. So we can actually use these information and enrich our RAF by like adding these up and creating one. So these were, I felt, some of the interesting aspects. And there was one of the project where I saw that the top contributors when like modeling it was the last one here, the percentage of income spent on rent by families in the neighborhood. It was quite interesting. Like I wouldn't have guessed it at all. It's about unplanned admissions, acute admissions in the next 2 months for like members. And I saw that this was actually coming up in one of the top ones. So certain interesting facts do come up and we actually include these factors overall. And now that I've spoke about a lot of data in general, that's just like an introduction. There are much more. But some things that I've done in the past and we're already continuing to doing are definitely everything is on databases, analysis on them, but some are sort of creating scores from it, like so that you can help the clinical team, the clinicians to help them like project at what point or like how every patient looks like, and they can use that for care management or you can forward that to the care teams, etc. And we've worked quite a lot on building different models for prioritizing with what needs they need. Like mental health, for example, it's very hard to find the needs of a patient who has a lot of issues related to behavioral health usually, because a lot of things are not documented right, especially in our case, our population who is very ill, like they have a lot of chronic diseases, minimum of 2 for all the members that we have. And usually a lot of them are not willing to talk to the care partners or doctors. The interaction is missing. So when that's missing, it's very hard to capture the data and give enough recommendations. So I feel like in such cases, certain data have helped quite a bit. I wouldn't say like completely that's the only one, but quite a bit in lifting the status of members. And yeah, that's a pretty short thing. So I was just here to say that SDOH is definitely going to help you. So I know it's an investment, a lot of investment of time and money, but I think it's worth it. And I feel like everyone should sort of give a try on figuring out how or different ways of incorporating that into our system.